to 24-year-olds was also on the decline, with a fall of almost 45% in the most recent year.
We're joined now by our friend GP Helen Wall, who's on the sofa. Good morning.
Morning.
I was quite surprised when I saw that numbers were not continuing to rise. Does that make sense to you, what you see and hear?
It is quite surprising because we know that it has been massive growth, hasn't it, over the last couple of years. I think there's a couple of key things in that data, really. One is that for the young people, it was the disposable vapes. So I worry that we're breeding a young generation who are very, recyclable friendly. Are they using other vapes rather than disposable is one query that I have. And the other thing is, are they turning more to cigarettes than vaping? But it overall, if that stands true, then that is that's a reassuring and a positive story, isn't it?
There's the question. Because if young people are starting to vape, do you think that they are now thinking, I am just going to stop vaping because I don't like the idea of disposable vapes, or are they turning to something else?
I hope they're just stopping, because we know that vaping in young people is not good. The NHS is very clear on its advice that vaping should be a way and a means of going away from smoking. So if you're smoking and you need to stop, and we would advise everybody to stop, because we know that smoking releases up to 70 chemicals, it's linked to about 16 different cancers, it's bad for your heart, etc. So our advice in the NHS is always to stop smoking. And we do say that vaping is a preferential option to smoking. But for people who've never smoked, and for young people particularly, to turn to vaping can be quite detrimental. And we know that there are often high levels of nicotine in vapes. Our young people are becoming quite addicted. It's affecting their concentration, they're becoming agitated, their capacity to learn is affected, their developing brain can be affected. So we really, really don't want to see young people vaping.
Do you see that in surgery, young people who are showing symptoms of vaping?
Yeah, I mean, nicotine is an addictive substance. That's what people get hooked on in smoking, and there's no less nicotine in vapes than there is in smoking. It's not got all the chemicals if you use a regulated UK product, and that's the other thing. There's a lot of non-regulated products getting into our market, which may have chemicals and so on, which are potentially dangerous. But if people are using a regulated product, then, that's a better option. But we certainly don't want to see young people doing that, because I do see that people are then becoming addicted to it, because nicotine is very, very addictive.
And when you say for young people it might affect their brain development, how does that show itself? Is it because it's teaching the brain to be addicted to something, if that makes sense?
Yeah, I mean, all our brains can become addicted. Addiction doesn't cross, it's not particular people, it's not particular classes of society or particular, ages. Addiction can affect anyone. It's an addictive substance. So, if young people are becoming addicted, then they're going to have the same difficulties at getting off that substance as they wouldn't. And I've heard from teachers who say, pupils in school, if they're not allowed to vape in school, by the end of the day, or even by the middle of the day, they're becoming very agitated. Their concentration is lapsing. They need to get that fix of nicotine. And, who wants to put our young people in that position? So I'm hopeful that this means that our young people are moving away from vapes. I think there's a few question marks over the study that's been done.
Yeah, it is really interesting. Have you seen young people starting to smoke cigarettes more? Is that something you've noticed anecdotally? Or
I haven't noticed it yet, but I think it's difficult because young people won't necessarily come in and tell their GP that they've started to smoke. We do ask people, obviously, when we see them. We don't see all young people, because young people, by and large, are well, and that's how we want them to stay. But I suspect that, that may be the trend that we start to see again, because these things ebb and flow, don't they? So that's certainly something that we'll need to keep an eye out for.
OK, Helen, thank you very much indeed, as ever. Thanks.
Now, back in 1971, a young rebellious